Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and here with me is Vancci. Vancci, please introduce yourself.
Hi, my name is Vancci Celestin. I'm an administrative fellow here at Luminous Health.
Thank you so much, Vancci, for joining us. You have such a varied career throughout healthcare. You've been, gaining all these years of experience. You started way back at George Washington University with their MHA program, very popular program. What led you to apply there, and what got you interested in healthcare administration?
Absolutely. Twofold answer. What got me into George Washington, I actually moved to the state of Maryland about a little over 3 years ago, right in the middle of the pandemic, May 2020. When I moved here, I decided I was going to go back to school and get my MHA. I already had that made up on my mind. At the time, I was working at Hopkins and I was working front desk at an OBGYN. The practice manager at that office was like, "Hey, you're considering applying to schools?" Like, "Yeah, I'm looking at the schools in the area." And she was like, "Well, I highly recommend George Washington as I am an alum from." I said, "Okay, awesome." I was already planning on applying, but like she really encouraged me to really push out there and try. So I went ahead and applied, and the more I got to know about George Washington, the more I felt like it was a program that was right for me.
How did you like the program going through it?
Absolutely. So the program is great. Spend your first 2 years in the academic setting, and then you get all your classes, you get your hands on, you get your experience in the on the education side of things, and then that second year they're really trying to push and encourage you to take that next step or that leap of faith and get some experience, whether you decide to go in a fellowship route or a residency. The way that one of the things that I really like about George Washington is that their fellowship program is part of the requirements for you to graduate. So it gives you that extra opportunity to really encourage students to go out there and try to apply. And that's what I like about it. Yeah.
That's excellent. And then, so you started way back during, undergrad in Georgia, right?
Yeah. Yeah, that's part of the other part of the question. So this kind of goes into the next part. So initially, I thought I was going to go for physical therapy. I started my undergrad out in Savannah, Georgia. During my time there, though, I did a lot of volunteer work. I helped, do a scholarship pageant, and I helped with like a scholarship for the university at the time. And when I did those projects, I realized I really liked working with people and like solving problems and things of that nature. So I decided I wanted to stay in healthcare, but I explored out a little bit. So after I graduated, I decided I wanted to get some more experience in the public health space and the healthcare space. And I started my first job at a federally qualified health center. And it was a primary care clinic. So I got some hands-on experience. I helped people sign up for healthcare insurance, and I got the opportunity just to learn what it's like to be in a healthcare setting. And I also had some support from leadership that, hey, if this is something that you're considering, here's some things that you need to know. And honestly, that first experience sealed the deal for me. And that's what made me want to push for healthcare administration.
Nice, good for you. And then, were you born in Georgia?
No, a place, I've been in many places. So I was born in Boston,
Okay.
so Patriots fan and all of that. I lived
Same
there.
here. Same here. I'm a big
Okay.
Patriots fan. Yep.
Awesome. So yeah, big Patriots fan. I was there until about 9, and then I moved to the state of Georgia. I moved around a little bit in the state of Georgia, moved to Jacksonville, Florida, and then ultimately finally came here to Maryland.
Excellent. Excellent. Yes. So that's what I was going to ask. I noticed you had that internship at Mass Gen, and so you went all the way up back to Boston. I was going to say, how different was that? But you lived there till you were 9. So is it kind of like going home in a way?
Absolutely. So it was a twofold opportunity. One, to get the experience of being at Mass General, but then two, to spend time with family as well. So it really worked out. And I had a great experience there. I had great mentorship, preceptors that really wanted to take the time to just teach me things and like walk me through things. And Mass General was really big on leading on teaching and educating, having a learning environment for whoever comes in. It doesn't have to necessarily be
Mm.
students. So it was a great experience.
That's nice. I'm envious. I miss the Boston area. I'd love to go up there sometime soon. So.
Yeah, the only thing I wish, it was, I wish the Boston Celtics at that time, if they could have won, that would have been great. That would have been perfect. Would have been the
I
icing
know
on
it's
the
been
cake.
they've had some weird trades going on. They've had some weird. It's felt like their roster was really good for like a half a year, a couple of years ago, and then it just went downhill.
Yeah,
And
yeah.
since Tom Brady left, I mean, it's
We're going through a season of change.
yeah, we are. We are. And so then you came back to Annapolis for your fellowship. I wanted to ask, how many fellowships did you apply to, and then what areas was it based on the areas of the country? Was it based on the organization? How are you making those decisions?
Yeah, there's a couple of things. So first thing that location is everything, right? Like, so you need to make sure that you're comfortable with the place that you live in. For me, I specifically wanted to stay on the East Coast. That's where all my family is. So that was probably the first thing I looked. I was like, where do I want to live? And I was like, I feel most comfortable here on the East Coast.
Mhm.
The second thing was looking at organizations that just generally, catch my attention. Either I worked there previously, or I just, I know like how well they're, or, like I know a little bit about their organization and things of that nature. But then lastly, the number you asked me, how many did I apply to? I applied to a total of 12.
Okay.
And so when I one of the things that I was looking for, so after I decided, hey, I'm applying to a couple of organizations here, what I'm thinking about, you started to ask, like, what exactly is it that you want out of a fellowship? And so when I started thinking of that, I was like, well, I'm in a place in my life where I really want to grow, but I also want to be in an environment where growth is like our key focus. Like, so I led with, I want to be in an organization focused on growth. And then also with my past experiences in healthcare settings, I really wanted to be in a community focused environment. And so when I did my applications and applied and looked at different organizations, Luminous Health was definitely on the trajectory, and it was a perfect fit for me.
That's great. And can you tell us about Luminous and what the work that you do there is like and how that fit into your goals?
Yeah, yeah. So Luminous Health is one. The organization is made up of three hospitals. So two hospitals, one in Anne Arundel County and one in Prince George's County. And then we have a behavioral health hospital here at Anne Arundel County as well. And then also we have about over a little over 100 ambulatory care sites within our system. So as far as with our two hospitals, they're both really embedded into their communities, community-focused hospitals. So serving Anne Arundel County and Annapolis, Maryland, and then Lanham, Maryland, and Prince George's County. So one of the things that were big, that was one of the biggest things that were focused at Luminous Health was their focus on building a women's health pavilion in the Prince George's County. They just seen an access. There's a need for access of care within that area, so they really wanted to provide that. One of the things that we always highlight, one of the biggest metrics we want to highlight about Prince George's County is that out of 10 mothers are forced outside of Prince George's County to deliver their children. So there was just this real big need to say, hey, we need to really provide care within our area. So that's where when I was, getting ready to apply, that was one of the big stories is, hey, we're looking to apply and build this women's health pavilion and really expand care and access to care for our community. So that was one of the biggest things that really drawn me to Luminous Health. And then secondly, is for me, I wanted a project-based fellowship as well, and that's how it's structured. I really wanted to just get in as much hands-on experience as possible.
Yeah.
So the way that the fellowship is structured is, like I said, project-based, but that second level of it is we work with the program director, who is Tori Bayless, the CEO of Luminous Health. So she oversees our whole fellowship experience. I have a co-fellow as well with me, and we serve at the two hospitals. So I currently work at the Anne Arundel Medical Center. My preceptor is the president of that hospital. Her name's Sherry Perkins, and so I work directly with her as she serves as my fellowship mentor and advisor. So she really, I meet with Tori Bayless at least weekly. Me and my co-fellow do, and then we meet with Sherry Perkins on a bi-week. I meet with Sherry Perkins on a bi-weekly basis.
Nice.
She really helps guide and like steer the fellowship experience for me. And then she also is serves as a mentor, so I can ask her as many questions as I want. She's an open book, and she's been really helpful.
That's great that you get to meet with, kind of the top executives in the organization on such a regular basis. That must be pretty impactful.
Yeah, absolutely. I think learning from them is a huge benefit and perk. I believe that one, just watching how they lead, not only in just their day to day, but like how do they work through their decisions? How do they work through any issues that we're working through within the organization? And then how do they lead other leaders? Is something that I really get the opportunity to see, and it's a great learning experience.
That's excellent. Yeah. So, what are some of the projects that you've been working on and that you've done while being there?
Yeah, so I'll name two. One of my favorite projects that I got to recently work on is we were working in the with the CT team. So the current issue was that we were trying to improve our ED throughput. So it's a common issue in
Yep.
hospitals. So we were looking specifically in the CT scan the orders. We're trying to figure out, okay, well, we're having a large wait time or a large CT scan order time to actual processing. So what they wanted to do was they wanted to say, okay, well, I think we have an issue in this area. Let's really dive deep into it. So I worked with the process improvement team and the radiology team, and we did a Gemba. So I got to go sit down and spend a day with the CT team and just observe, just watch their day to day, just see the things that's going on. So
Mhm.
one big benefit for me was just getting that exposure, just being able to spend time with the team, watch what it's like to be in that space. But then two, just really start talking to people and asking like, okay, well, what do you think are some problems? What do you think are challenges here? And just really just soaking in, being a sponge. So after we did that assessment, we came to the conclusion that we realized there was a couple of things, but the biggest thing that we noticed was there's an opportunity to reduce our wait time, specifically with transporting our patients to and from the CT scan room. What we found was that the actual scan itself took relatively minutes, tops 10 minutes, depending on what the actual procedure was, or 10 to 15 minutes, depending on what the actual order was. But the time was really on the time it took for the patient to arrive and the patient to go back. So what we did was we looked at that transport team and we looked at how it was structured. We realized there was an opportunity to we have a centralized transport team, but we realized it might be more effective to just have a CT tech aide directly in the CT scan room team. And so we basically came up with a new care model for that unit. We basically restructured a couple of things. And then we, just to back it up, my role in that too was to say, hey, what is the data that we need to say this is something that we can actually move forward with? And one of the things that we found was that about roughly around 70% of our orders were coming directly from the ED. So a majority of our ED orders were coming from there. And so we decided that maybe it would be beneficial that kind of helped support our case of, hey, if we had someone and part of the team who can help transport those patients directly from the ED to the CT room, we can greatly reduce our CT order times. So ultimately, we came up with a new structure. And one of the things that I really enjoyed about this new model, too, is that there was an opportunity, from our perspective, there's an opportunity to not only have a new staff member part of the team, but then also we wanted to have this level of growing for the opportunity for career growth or career ladder. That's the word I was looking for.
Oh, yeah.
And so with that, having someone directly part of the team, seeing the opportunity to be a part of, become a CT, and then also continuing with the organization was something I thought was a really cool idea to incorporate. So we're currently in the process of actually rolling that out, and we're actually just going to observe for the next few months to see the success of it. But I do think that we'll be able to greatly reduce our CT order times with this new care model.
That is a super cool project. And you're like right involved with it. I noticed you mentioned the Gemba walk. And so, are you trained in Six Sigma?
So that's the part of the second part. So one of the other projects that I'm doing is I'm actually going through my green belt certification now.
Oh, nice. Good for you.
Yeah, yeah. So in order for me to get that, there is a project that I'm working on as well. I'm working with the patient experience team. They're currently going through the process of just restructuring some of their governance structure at this time, but then also saying, like, hey, we have a list of projects that we're working on, but we just need a singular place to actually um, hold all those projects in one place. So I'm helping them build that project management tool, but then also trying to align that with their current governance structure that they're looking to build as well. So that in order for so I will be getting to answer your question, I will be getting the certification once I complete this project. So
It seems like you'd be cut out for it. It seems like you have good experience for that. Are you looking to do process improvement like long term? Is that an area that you're interested in?
Definitely open to it. So at this point right now. It's in the application phase of like what's the next role for me. I do think that process improvement is actually really fun to do, especially when you get to say like, hey, we looked at this problem, we were able to work through it, talk through it, and we were able to collaborate with different individuals, and then we've actually came up with a solution for them that they've been able to take and run with it. And then being able to see the I guess the fruits of your labor in a sense is really cool as well. So definitely something I'm open to.
Are you looking at staying in the DC area? Are you applying all over the East Coast? What is that looking like?
Yeah, I think I'm open to staying in the DC area, but I also kind of similar to when I was applying for fellowships of like, hey, I'm open to staying on the East Coast, so keeping an open mind. And my organization is supportive of me. They encourage whether you stay or whether you go. They just want you to continue to grow. And they really wanted to focus on my learning experience, and they've definitely tailored that for me. So right now, I'm looking keeping an open mind.
That's excellent. So I want to ask about that too. It's always the anxiety when you apply to your undergrad program and then you're anxious about applying to your grad school program and then about the fellowship. Is it are you less anxious now about your next role, or has the anxiety been the same throughout all your roles in terms of like the applying process, getting a job? What's that like?
That's a really good question. I think I think it's a little different now. I will say, I'll say the fellowship experience. One of the things that you know when they're looking for fellows, they really want to get to know you. They really want to know a little bit about you. Like so, they're asking general questions like, "What do you like to do?" But then also they want to know what you've learned from your program, how you can apply those things. So, but prior to that, in previous roles, the question was always like, "Are you qualified for this position? I'm looking for these key skills." So I think right now I feel like it's going to be a little bit of a mix of both. Of like, what skill sets do you have for this specific role? What did you learn from your program? And then tell me a little bit about yourself as well.
Yeah.
So, so I
They're
think,
gonna hit you with all three then from here
yeah,
on out.
yes, yeah, yeah, even better, all three. So I feel a little comfortable, but I don't necessarily know what to expect just yet about the interview. So,
Of course.
yeah.
So not to, we don't need to mention any specific numbers here, but what is the living like in the DC area? We have some people, from across the country interested in moving here or there. So, in terms of the salary and the benefits, are you able to live, okay on what, in the DC area, or is it kind of a struggle? How would you describe that?
So I think let's see. I would say that DC in particular the prices are going to be a lot higher. But for me, like I live right outside of the DC area, so I live right in Silver Spring, Maryland, which is about 30 minutes on a train ride to DC. I would say DC, in particular, the city area is a little bit pricier. If you live right outside of that area, if you look in the surrounding areas, you might be able to find something a little bit better. I think it was more common for you to have like roommates if you live in DC area versus like in the little bit outside. You may still want to have a roommate, but it's you don't necessarily it's not necessarily required. As far as what to do, though, plenty of things to do. One of my favorite things, because I lived most of my life in the South, so like coming up here and having like a train that is actually very usable is pretty cool. So, getting around the city is not really much of an issue. So there's plenty of things to do. There's plenty of activities on the weekend. Right now we're in spring, so in a couple of weeks cherry blossom is season's coming out, so a lot of people are going to go out and about and see that. So as far as a living area, there's plenty of things to do. So if you like sports,
Awesome.
there's stadiums, there's concerts, there's all types of things here, and I've been having fun. Oh, and also DC is a foodie city, so you
Yes.
want
Yeah.
yeah. So
Yeah.
brunch, food, all of that, that's just part of the culture. So there's plenty of things to do, plenty of food to eat.
Excellent. So you'd recommend DC as an area people should, keep on their lists then, maybe live a little bit outside the city, utilize the great transit there, the nationally funded train system that they have
Yeah.
there. That's
I would recommend it. Absolutely. Yeah.
wonderful. Thank you so much for coming on. I really enjoyed talking with you. It sounds like you love your program, both your graduate and your fellowship program. So we're gonna link those in the video description here, so potential fellows can check them out. I really appreciate you sharing your insights with us.
Yeah, absolutely. Thanks for having me. It's been a pleasure talking to you today. And
Thank you.
thank you. I will look forward to seeing the posts.